an hour east, west, north, or south, and they're even less, and there's no resources, and so communities really struggle. So I think those are things we discussed. And Fortunately, I think the way things are going, resources are just gonna get worse and worse and worse, so, I hope this work continues on and we can find creative ways to fund these, but, in my experience in legislative, just get the funding, all the ideas are fantastic, but they never matriculated in anything that actually solves any problems, so I think education is a big key. When we get people more tools than just a hammer. There's always problems.
I mean, I love that y'all community talked about the fact that like, a lot of it was 12 and under, but 13 and up right now is only 15. Is like the way to get those supports, and I think what the research shows is like a lot of our kids who are being charged with illegal sexual behaviors were young children and actually had problematic sexual behaviors. And so it really feels, excuse my French, shitty to like be like, oh, well now you're 13 and you're charged with this, when it's like this has been happening for years and nobody has supported, and that's why I'm not.
Well, in chronological age, and you think about the developmental span of children, they would suddenly hit 13 and and we have developmental delays and things like that. So really having, and there are times they're gonna be 13, behavior is on the line, right? It's not necessarily criminal charge, but there might still be safety issues that we as child welfare need to be involved in, so we have to have pathways that aren't just through the juvenile justice system.
Yeah, the having things developments like participant and yeah. So, we are gonna have hopefully some time for some small group discussions if there's specific questions that you're working through. We talked about additional resources. And there are 2 other working groups represented, so. So thank you for the yeah, so Jenna.
Yeah.
Take it away.
So I finally just kind of like spitting it out and of this here. I
There are
feel like I'm
different
gonna go
ways
off
to
the
do
rails.
it. Valid and encouraging, flexible, way. I did it this way, you do it. All people are different people.
Yes, yeah. So, and we had a few members from my group, including Ellen here, and, Jesse responded to this as well, so it seems like, yeah, I wanna make sure everybody's voice is heard. And I'm not as great at speaking without speakers, so. Our, framing and vision was that we're trying to address the significant gaps in community and mental health services available for children and families engaging in and impacted by CSPs. So really speaking again to this, like the lack of services, resources, and ways for these families to get support. Our set of values that guided our recommendations were a vision of a state with well-trained families, community and child service providers of all types, alongside readily available therapy providers with expertise in evidence-based treatments, which will work to support young people to get support they need without the need for juvenile justice involved. So really kind of increasing the amount of education available for anybody who is working with these children, so not just mental health resources, not just school-based resources, but really like kind of across the board, really making sure that people have a better understanding of what healthy sexual development looks like, so we're not hyper-responsive or hypo-responsive to what we're seeing. And then development, our values were developmentally appropriate services. Youth and young adults are not small adults, and so a lot of times, like the research shows, the way that we've treated juveniles initially was the way that we treated adults who have engaged in sexual offenses, and that doesn't work because adolescents are adults. And then what we're seeing is, okay, well, that's how we did that with juveniles, now we're doing that with kids, which is even more problematic. So really wanting to make sure that we treat each developmental age group as their own developmental age group. And using trauma-informed practices involving youth and family-led supports, and then valuing restorative justice over punitive approaches. Our recommendations, we had quite a few, but we wrote kind of 3 main ones, and one is creating a hub within OHA for all current resources related to PSB and CSB, as well as PSP providers and services available within the state. This will aid tremendously with connection to specialty services and education, especially for folks in smaller counties. So again, talking about a statewide hub that really has all of the information that you could need. And that being like maybe having different branches. So like if a family or child is engaging in these behavior, the child is engaging in these behaviors, their parent can maybe go to this hub and see, okay, these are the people in my community who are experts in this area, or here are some online resources. But then also having like a spot for maybe mental health therapists who can like look at, okay, what are trainings in the area, and then having like MDT groups and just kind of like an overall, like think of it as like one giant brain with everything related to this topic and really creation of a system of trainings with tier 1 broadly available trainings for families and community members, tier 2 for child service providers, and tier 3 for specialized ethnicity treatment providers. So similar to the structure of suicide prevention trainings that we have in the state, there's already that blueprint there. If we can just kind of like take the suicidal piece out and put in the PSPCS piece, that would be ideal. And then additional training to provide a pipeline of support within therapy. So that would look like increasing training programs, increasing the amount of continuing education units available for currently practicing therapists, just kind of creating a more extensive spotlight on this area and providing the training that's needed in order to provide the ethical services without kind of, again, hyper-responding. And then look at current existing models that are up and running, like New Jersey, Minnesota, I think is also in there, and determine new paths to specialization within Oregon. Something our group talked about was the specific ORS within the state of, it's like 675382, but really it's just that anybody under the age of 0 and up would be needing to meet with a clinician who's been certified by the Sex Offense Treatment Board. And though I think that's good in gatekeeping to make sure there are well-trained clinicians, somebody who is well-trained in treating an adult with sexual offending behaviors does not necessarily a 7-year-old with problems with sexual behaviors. So really creating different ways of being certified in a specialized route and just like having that. All right, and then how are examples would improve the system for children, families, and professionals? We believe that consolidating and streamlining state resources will lead to increased access to treatment support, ultimately leading to a framework of prevention rather than reaction. The norm can shift to proactive engagement with these youth and families, and then we'll see less of the reactive pieces like the juvenile justice system later on in their lives. And better education enables families and professionals working with these families to identify the CSBs or PSBs early on and prevent cycles of harm from occurring. A better trained community can help to break down stigma for these youth and families, and it can just kind of become another part of education. And then implementation impact. The key steps needed to begin implementing these recommendations would be a creation of a position within OHA to oversee this work and coordinate interagency program work. And Jessie really helped with this one. I think this is more like her purview. And she talked about how like this position would require funding and would require authority, and like OHA might be the appropriate place for that. Creation of a steering committee comprised of youth and families across agency representation. So really ensuring that the voices of those we're serving are being heard. Completion of a statewide landscape analysis and resource database of services and supports. So really understanding what's out there already. But at least knowing where it is, so that way we can kind of pull them in and get some support. And better understand like how they were able to like, set up and what they're doing and how they can export that elsewhere within the state. And then a creation of statewide training plan, including current trainings, analysis of gaps, and writing contracting for training to fill those gaps. Review of national best practices, and changes to Oregon structure for funding / reimbursing PSC treatment based on current clinical best practice for use. So that's something I've heard across groups too, is really talking about the specialty that this requires and how, like, I can speak from a clinical perspective, but I think that this is from other perspectives where the case rate is the same for a child coming in with anxiety versus complex trauma and sexualized behaviors, and like the level of, like, case management and consultation and things like that, so drastically vary between those two. And so wanting to make sure that those who are specialized in these areas or wanting to get specialized in these areas have kind of like a bit of a monetary incentive there. Because already we see a lot of people kind of shy away from these topics. And so if they're going to, I think a lot of what we talk about is how to get clinicians and other professionals into the field and help them stay in the field, and I think that's just one reality. Who needs to be involved to make it work? We kind of put everybody, so youth and families with lived experiences, state agencies like OHA, ODHS, OYA, ODE, community-based organizations, educational institutions, so kind of like having those come in for some of the trainings and things like that. So community colleges, universities, master's level therapy training programs. We put OIA, but also just in general, the juvenile justice system representatives, so judges, district attorneys, probation officers, so on. And then victim advocate services and organizations. What impact do we hope this recommendation will have in 2 to 3 years? Well, if our wishes came through, and all of them in the world, we would see a significant reduction in the number of youth receiving any kind of charges for illegal and problematic sexual behaviors. There would be a coordinated problematic sexual behavior specific service across Oregon, or services across Oregon. A tiered training model for addressing problematic sexual behaviors throughout the state. Increased rates for training providers of PSP treatment. Increased county-to-county communication, and sharing of resources via a centralized hub. And we talked about the creation of those hubs. And this is just an example, but like 4 to 13 and up, we already have the OASA, which is the association, for change the name, treatment of sex abuse.
Treatment and prevention, sexual abuse.
Thank you. And then OSOTN, which is Oregon, or what's probably the same, but Oregon Adolescent Sex Offenders Treatment Network. So that'll be like for 13 years old and up. And then for 12 and under, really tap into the child advocacy centers, the multidisciplinary teams, and OSOTN for 12 years old and under. And that will ideally provide an up-to-date report around best practices, research, trainings, resources that are present within the state. Will kind of have people from all different parts of this work. And then community engagement, how should community members be involved in shaping or testing these ideas? We believe that youth and families should be involved in the creation and implementation of these ideas from the onset. So co-creating the plans alongside state representatives. And then agencies, practitioners, and group offices, both those who are reluctant to work and also those who specialize in the work. So we kind of talk about those who are already present and saying that on going to do this work, if not why, and then if you are, okay, how can we kind of like utilize that more? Hey.
Yes. You gave it all of them. Right. I'm happy to hear that. People. Debbie, do you want to talk about how we're gonna fund all this?
No, your table. Geez, like, okay, my gosh, not to have the money, but really, yeah, our group was small but mighty. I'm really who is the director of that you said on Columbia County, thank you very much. And Kelly from Wood River and their community And Jen John is Department of Education, and she was stretched thin because I think she was on the one where her. So we had a lot of discussion with the current funding climate that to not get discouraged, but to really look at a holistic budget that included the recommendations from each one of the work groups to try to come up with a very robust plan of what, or budget, what needs to be included in that, and we have some ideas about the variety of kinds of jobs here too, about how to secure ongoing funding and how we get that legislated so that it isn't so inconsistent, starting stops. And this organization does not have a cohesive budgetary plan for the service, so I would create that and get that with some guideline with this. I too wrote some things out, so I'm just gonna go ahead and read as Jenna did, and yeah, I know there should be a question that. The recommendations from the funding streams work group are aimed to alleviate the significant shortfall impact the state funding of surveying the state of Oregon's families experiencing the impact of CFP and stigma. The recommendations are inclusive of the broader scope of developing a comprehensive response to the requirements of HB 4086. The recommendations are inclusive of and incorporate the funding requirements identified in work groups in order to comprehensive budget that supports a holistic response. Additionally, the recommendations include legislative changes to building accountability for secure and sustained funding for an eventual full implementation of the bill's committee's recommendations. Our vision and guided values that guide us. Every family deserves to be treated with respect and dignity and understanding as they face the challenges from experiencing CSB to PSB. The value of culturally and holistically trauma-informed services that empower and include families throughout the process is paramount. Every family deserves a consistent response, access to the array of services needed to support healing and restoration of the and have the professionals involved educated and trained with best practice protocol. The value of early intervention, prevent further legal, psychological, and other potential damage and consequences has been enforcing the consideration. Our recommendations, again, some of this has to do with, we want to really uplift each one of the work groups' recommendations of their expertise and diving into one of their specialized areas that they were asked to look at. So we might, you know, the work group's recommendations that you've already heard some of. But the main, some of the main ones that we recommend are the legislative changes to mandate sustainable funding for a statewide CSB and PSB response plan with rated funding from key system partners, IA, ODHS, OHA, and others. This would include a line item in the state budget for a program, this program to be developed and sustained. Further research of potential alternative funding sources through grants, government programs, and philanthropic sources for startup costs with clear expectations of sustainable funding from the key system partners following these funding sources. The development of a task force to have oversight on ongoing recommendations from House Bill 4086, including development of a comprehensive budget that includes recommendations from each one of the work groups of a holistic response to the debate. One example or examples that would improve the system for children and families for professionals. The implementation of the changes recommended would ensure that families would be able to experience a consistent and culturally informed response when reaching out for services. Providers should have a sustainable rate to provide the best practice models of the range of services that families need. Additional families could be served. Development of educational materials to inform communities, child care, educators, juvenile justice, judges, and more about the needs of CSB and PSB. Rural communities will have access to resources to serve families locally and a longer-term outcome of preventing further legal system involvement. Development of higher education training and more easily access to certifications for recruitment, and sustainability of a highly trained and equipped force to address those. Key steps, legislative mandates for securing sustainable funding in the state budget. Program development, creation of task forces, for example, work of hospital recommendations with clear timelines for implementation and accountability. It needs to be involved. With the task force, again, with the key systems, but also community-based organizations, family and youth advocates, and individuals and families with lived experience. We will be focusing within 2 to 3 years. Money. Reduction of reoffense and trauma reoccurrence, increased access to a broader range of services for all children and youth experiencing CSD and PTSD without requiring criminalization. Strengthening of process and coordination and accountability in expansive culturally and trauma-informed practices statewide, training and retention training skill force. And you should be involved. The development of an advisory committee that includes representation from each region across the state with members representing the locality's cultural lived experience and regional differences. This advisory committee will be housed under the entities that the legislature determines is leading oversight, so monitoring that. And community outreach with roundtable discussions here to review, provide input and influence the process moving forward. You know, when we thought about just the funding of it and looking at just the different work groups and thinking about how massive is this budget? It isn't just about, developing the system and, how do we get those positions funded within each one of these areas? In fact, our committee was pretty concerned about, again, with the current financial situation involved here, not putting the mandate or the burden on the backs of any agency or entity to try to roll out any of these recommendations, though they are phenomenal. But without the funding, the burden will place on any system. So careful, we want to put these recommendations out there and really want this to be looked at seriously, which is the legislature cannot give up the hope of getting that funding, but we even want to think about giving a slow roll to this and to be very careful about not putting the burden on the agencies or entities without the funding to start it.
So like, you look for one profit or another way.
Yeah. I think it was really helpful. Even I think for Carolyn had to really, how they were able to look into some of those philanthropic opportunities and also looking at how to do cost rate versus base rate. And so they built it. You could use that for the state, so already done this, visualize the model of the funding and how do we, create that within working things.
Yeah, and the philanthropy I know you all have talked about too is for some of these things that sort of maybe require like a test or a pilot or a smaller test before then legislature can embed funding in. That's where philanthropy can play a role in that, like sort of incubating and that startup phase. And then there's data and evidence to prove, and then there has been more formal funding that comes in that. But in that, making sure that there's no unfunded mandates, that if there is sort of in this initial phase, philanthropy can come in and help do that.
Also, that there is more work done to look at some of the specifics. We got in weeds with some of this, remove Z codes or include Z codes, and yet when we do a little further research for building, that really is only for sex offense treatment, and that isn't looking at holistic mental health treatment for children and youth impacted and families. So that's not part of health. I mean, it's going to be more fantastic. It will look at the journey of the best.
Yeah.
I think you should like making the prevention add on too, right? We know that it's more cost effective interventions, right? And so you can get someone to do some good math for us about, right, like what's the cost once a child enters juvenile justice system for a sex offense versus what's the cost? I think we've done that for other abuse prevention work, like if we could come up with some great talking points about that, that, especially for like a grant application, would be really helpful, you know, have access to some. Not being an obvious person, have access to, and clearly articulated message on that.
It's a secondary economic piece too, because gives you, especially with sex offenders, you don't have harm prosperous for the most part, and so there's economic balance to that as well, which, yeah, we'll just start that.
Yeah.
It's huge.
I have a couple questions. I was under the impression that, on regards to that, my question. Children who are in foster care, you know, that's somewhat of a concentration of traumatized children, and they sometimes act out on each other. Is there a specialized approach for children who are in foster care who harm other children? Because, and I'm taking an opportunity like this to just be vulnerable, you know, as a caseworker. I remember I was in a position where it's called the placement desk worker. So I was responsible for matching children in foster care with a foster placement. And I remember placing a child in a home, and it took months for him to be comfortable enough to share with us that the home we placed him in was with a child who had already been perpetrated. And the agency was aware of this, but it just wasn't in the case file. I still listen to this day, knowing that I played a part in placing that child with another child. And I'm grateful that he found the courage to say something. And so I think it is important to make sure we have a specialized, targeted approach for the children who are in foster care to ensure that we are safe while there.
So a valid point, and I, as I'm thinking about it, I'm wondering if there is that, you know, so other considerations, because I'm just thinking about the training for resource parents. And making sure that our resource parents feel equipped to care for kids when they've had problematic sexual behavior. Because if you know, I actually managed to break workplace the best in D2 is when I first moved here, and it's hard when you need to place a child who's had that behavior, because you know, making sure there are other children and you know, just that safety stuff. And so I wonder if there isn't room for another sort of recommendation around just how we best support those kids when they are in foster care.
Absolutely, but also understanding that a lot of the times you won't know until you know.
Yeah.
You won't know that that child has sexualized behaviors until they see it. And that is a risk of having children in foster care with other children who have behaviors that we just don't know that they are yet. So that was, and again, because I was under the assumption that this committee was focused on children in foster care. I mean, of course, other families in the community, but the core was children in foster care. And so I was just, so then it brought up other questions, like I think only 10% of child welfare allegations, substantially allegations, are regarding sex abuse. So what was the trigger that said, this is big, you need to work? Yeah, you see what I'm saying when you have. Yeah.
Oh, I can answer that, but are we gonna do it, or do you have time later?
We were gonna take a break and
Okay, okay.
but I mean, if it comes around again later, I think that's okay too, so.
And we can answer, I'm like, they just plant the seeds, so we can start thinking about it. I love committees, but I also love outcome data. And so any committee that you guys recommend, you'd like to see something, some key performance metrics that show, because that's how we know if it's working or not, right? We can put our best guess forward and think that I think this would work, but the only way to truly know is to have indicators that, yeah, this is indeed in alignment with what I thought it was going to do. And so it is absolutely paramount, I think, that you have some kind of outcome measure. Yeah. And we can answer those later in the day, whenever we're done.
I wanted to name for our community education group, their primary recommendations were really around partnering with schools.
Okay.
And that the school system is one of the systems we do want kids and families interacting with, and so how can we be building out resources and tools for schools to be educating teachers, parents, other community members, so, and similar to the funding group of the content of that plan is based upon the other two work groups of what being able to have resources and tools for schools around what community resources there are, what mental health resources there are, what the pathway is to be, if there's a support line or if there's a calling hotline, the content of that communication, community education should reflect the recommendations of the other work groups. But their primary recommendations that this should be done with schools. And other community partners, but schools are the key lever there. So what we're going to do now is we're just such a yeah, so
Yeah, this is 10-minute break, till 10:30.
yes,
Yeah, that means.
yes, so we're gonna take a 10-minute break, yes. Yes.
Overnight.
Yeah, like, oh,
Sort of.
yeah, yay! Have you all like been able to see You should do more. I did more with your more. You need to eat this. You're like, I don't wanna have to deal with it. Please, or take it with you. Yeah.
Yeah.
So, all right, we're gonna, this next part, oh, sorry, let me make sure this is, okay, great. All right, so this next part is originally designed on the. Hey, we're gonna get started. Thank you. All right. So this next part originally was designed as roundtables when we thought we were gonna have a fuller group, but we're gonna go ahead and just have an open group discussion. We do have handouts for a few of the work groups, so if you did not receive a handout and you would like a handout, please let us know. We have a handout for the funding group, work group, and also for the expanding mental health work group. But before we get into the discussion, we did want to ask Lisa to do just an abridged version of what she's going to present this afternoon, just to give us more context setting about how we arrived here today. Thanks, Lisa.
Yes, that they prepared me 5 minutes or less. So the short version is, the initial bill was set to look at how we assess abuse in the state. So, Michelle and I will talk in more detail later, but Oregon is very unique in that we have what we call third party abuse. So we don't require a caretaker sort of status in order for child welfare to get involved. We are like the only state in the country that does that. Every other state follows a lot of the law, the language in federal statute that comes out of CAPTA, the Child Abuse Prevention and Treatment Act, which says abuse is the acts or omissions of a person responsible for the care of a child. So typically a parent, guardian, caregiver of some sort. And so one of the biggest worries, I think, by legislators and advocates about backing away from assessing everyone, is that people are gonna fall through cracks, kids are gonna fall through cracks. And so we, which is a valid worry, but we were really looking at who makes up those sort of third party assessments. Sometimes they're strangers, they're internet crimes sometimes. They're often children, minors. Sometimes it's an event that happened at school. If we read our code literal to the word, like we would be assessing if a kid got in a fight with another kid at school, it would be considered abuse to a child, even though it's another child. If you went to my orientation, got a real long history lesson, there was a reason actually for that, and that was to kind of just describe how child welfare came to be and what the scope of child welfare is. And really to say, yes, child welfare has a role in this, but it can't just be us. Our workers aren't clinicians, they're not treatment providers, and so it was really looking at, if we're gonna change the law about who we assess, we can't have folks including this particular population. The other committee out of this bill is called the jurisdiction committee, so they're looking more broadly at the statutes that define what abuse is, who we assess, due process, multidisciplinary approaches. And so they're doing kind of a more thorough look across the legislative language and jurisdiction of child welfare in this group, because this is such a sort of unique population, we recognize a need for therapeutic interventions and more systematic response besides just child welfare. It's set aside as sort of a separate. And so we'll talk, I think this afternoon, we have more time to kind of dig into that, but that's sort of how it started. Our first bill actually, we were trying to we wanted to have that clarity around who falls within this jurisdiction of child welfare. And lots of folks were worried. They were worried that if we don't do some more work, that all of a sudden DHS isn't gonna respond to these, law enforcement isn't gonna wanna respond to these because they're kids, you know, who's gonna respond? And so they agreed, we'll do these two committees, we'll study the issue for a year, come back to us with some recommendations, and then maybe we'll think about statute changes. So that's kind of, and I think they did it in 3 minutes. That was the short, nitty gritty of how we got here, and we'll talk, I think, a little bit more, but, so it's really more about that system response. Absolutely, kids in foster care are a population that's gonna fall into that, but it's much more that front end, like when a call comes to the hotline, or does it have to be a call to the hotline? Is there some other approach? You know, how do we define abuse? Because I just tell you, philosophically, this is as a survivor, I have hard time when somebody calls and wants to there's a 10-year-old, go out and assess them and put them on a list forever. We don't have automatic expungement in the state. Child abuse registers cause a ton of damage to people, particularly communities of color. We know that, and so there's a great interest around reforming child welfare, and you know, that was kind of our, you know, April and I kind of got when April was here, I'm just sort of already. Put our heads together because we worked in other systems. So I worked in Iowa, she worked in California, and when we both got here, we were like, wait, we do what? We go out and assess like stranger abuse, like that was just a foreign concept to us. And so, you know, still lots of work to do, but that's kind of why these two committees were set up. Yeah,
Yes.
yeah,
And I would say that, you know, the same is true for everybody. It's on your record.
I know.
It's on there forever.
It's
It
wild.
can never be expunged.
It's so
So,
wild. We have.
But I, that's the other committees and.
Yes, yeah.
That makes all sense.
Yeah, of course, we had like automatic expungement of all places, you know, if you had to Oregon, I was like, oh, this is gonna be so progressive out here, and I was like. Right, you're right. And I was like, we got automatic expungement, we have strong parent like partners, we have some in-home services, more so than I saw when I got here, and so, so it's been an interesting journey, but I think, you know, it's striking that right balance of like, safety is important, and we need to be really cautious about how we intervene in people's lives and contribute to the rest of their future.
Yeah, thank you for that information. Help us explain, sure.
But I'm glad you brought that up.
fall, you know, through the cracks, so.
Yeah,
Very good.
yeah.
Very good.
Yeah, but because it does come up a lot within foster care, and sometimes even those initial allegations will come up as a situation that happened in foster care, so we shouldn't forget that population.
All right, thanks, Ken.
Still good.
Well done.
Thanks, Gary.
Yeah, so for our.
There we go.
Yeah, yeah. Not there, it's great.
She must be always.
Yeah. Yeah, so we wanted to open up and have some space for discussion. About some of the recommendations and ideas that were shared. And so really. I put some reflection questions up here, but really this is open space, so if there's anything that really stood out to you. If there were any like needs, gaps, or patterns. That you heard, how does this align with work that is already happening or that you're seeing in your own communities or your own systems? And then if there's anyone else who needs to be a part of this conversation. And then anything else that might be coming in, like up for you right now, but we wanted to just make some space for some crosstalk and discussion.
I can start this off. And it probably is most of your question. Just in general, and listening to you pour out the group presentations, they're good, but to me, what I heard and just kept hearing was, it seems to be the same traditional groups that we always engage with. And at least for communities of color, we know there's an administration that ain't caring about communities of color. And so the reality for us is, we're not waiting on somebody else to do something for us. But it's like, what do we need to do to take care of our community? So one group that I didn't see anybody talk about is, you talk about community-based organizations, that nobody talked about community health workers. You're talking about training all these people, the people who are doing the boots on the ground work in this community that I know where I live, and in the Tri-County area, there are community health workers who are doing that job. And so, to me, I would encourage you to think outside the box. That's the best way I can say it, is think outside the box. There are groups out here that we haven't tapped in, that we need to be tapping into, because they're the ones that are doing stuff in communities. I mean, I was in the community health work. That's pretty good. But that means that it really is helping us to look differently. The other thing I think about is, there's an association of working black social workers. And I also know, as we talk about clinicians to do this work, there has been a major impact to them being able to get licensed as licensed clinical social workers because of the bureaucracy, that's the word, the bureaucracy that, or gatekeeping, whatever you wanna call it, but it doesn't work the same for everybody. And so you end up having people educated that are not able to be supported to be able to get the licensure they need. Because the one thing that I do know in working in our communities is that people are really trying to look for people that look like them. Because they're tired of having to explain everything. I tell you something and it's like, oh, this what I mean. Listen, that's too much work. I'm tired already. I got time to tell you about all that. Can I just find somebody who kind of gets it and we can just move on from there? So that's a gap. I mean, this is great. And I think that you did some awesome work for 9 months. And the reality is you don't get all the things, but those are some pieces that I see is like, what are some of the systemic issues already out there? I heard somebody talk about the training on suicide prevention. Their community health workers are being trained. And so that's why that just is a great thing for me, because I'm just concerned when we start talking the institutionalized systems, those have not been kind to people of color, not even their employees of color. So the reality is we ain't feeling it in a nice way. And so it's really a matter of when we're in a climate where people are trying to erase you out of the books, we want something that allows us to stand up and realize that we've always been resilient. So bring us into the mix and we can help you work in our community. Another one with schools, somebody had said, oh, schools. Scratch it. Because with the gentrification that has occurred, at least in the Tri-County area, our schools, at one point I could say, oh, the Port of Public Schools, but our kids are spread out throughout the Tri-County, as far east as they are west. And the reality is, those school districts can't help our kids because they don't even understand that school. And then I have another layer for you that you haven't thought about as you do this group, is we have a large population of African immigrants from various parts of the diaspora. And they go into some of our schools and you got teachers, kind of one that failed or whatever, or have an issue with them, and they like, give me your best shot. You don't know where I came from. You don't know what, listen, this is that ain't nothing. And so really helping people that be educated who are working with these communities and these changes. And that trauma for us didn't just start when the abuse occurred here, that you got to know stuff. That trauma started way back before that boat left Africa. That's where our trauma started. And people always want to say trauma informed. So I'm of the curiosity of, so where does yours start? Because I don't know where mine started, but where do you think I'm at? Because you have to meet people where they're at and talk with them about where they're at versus, it doesn't work. So, I think it's great, but I just see that there's a lot more work to go. And you already said that there's just a lot more work. And I'm optimistic in a way, but it also depends on where people really put their priorities, because just like everything, funding especially, they ain't only money looking for funding. I don't know about you, our state is got a deficit. Our school districts got debts. Our county got a deficit. Our city got a deficit. And everybody want money to start that. So it really is trying to figure out how to make that happen. And in some ways, we ain't no money.
I love what you said at the community workers, but I think it's critically important that we get, what are the boots on the ground in the community? These change, that we've got to figure that out. And I think as far as funding, it's only that we have to be realistic, it's only gonna get worse. I heard this morning just driving here, on Oregon Public Radio, that the budget's gonna be for food, for SNAP benefits, for benefits for people in Oregon are gonna be at such a detriment that, and the federal government isn't gonna be doing anything here and for any other state. So where does that money come from? So if we don't even have money for that, then how do we have money to do additional new programs? So I mean, the realism has to be there, and that's why I think about it, we talked a lot about paraprofessionals, and one of the things when I came from Iowa that I, years ago, in the nineties, yeah, I think you did, I mean, that nineties, Burlington, in Mount Pleasant. I've been to so many places, but that, I'm from that area. And, one of the things that was done there was creating like you get a master's degree in another, discipline. Such as I have a master's degree in theology and I went to seminary, and so in Iowa, I was able to get my social work and go through a little miniature series of courses and get my license, but it's not good here. But I had all my other, my background stuff, that helped me to just go through that little program and be grandfathered in. Well, that is a wonderful way that I couldn't afford to go to, I'm gonna get another master's degree. No, probably not gonna happen. So, at least I could do that, but if we could do more of that kind of thing, where or with a community health worker, here's a program you can go through to get a certification in working with youth who have, problematic sexual, behaviors. Awesome, so they get this little bit, they get grounded in some really concrete ability to make change. They don't have to go through a whole other program, but they have something that's very valuable and they become the boots on the ground. So why are there not more avenues for that here? Or we just have to create them, I think. We have to figure out how to create more pathways to utilize the gifts that so many have. And there are people out there who, with a lived experience, who if they could get some, okay, you get that, this was a state course, they'll hide, maybe make a little extra money, and then working with this community on behalf of people that really need me, but that I get them and make it. And I think a lot of that's been done with suicide.
And that's real valid, is that even in hiring us in on a board, and what we're thinking of is like, what are some certifications that we can do? Because everybody that has the money, well, they really don't have money now. So to think about going to graduate school, but what can I get that will give me the credentials I need to be able to do that work, and people know that I'm valid versus. I don't know, you really know what you're doing. And that's what they've done with the community health workers, is they are creating avenues for them to be trained. And so I appreciate that, opportunity of looking at how can we educate people who are already in the community doing this in a way that's not the historical, oh, you got your high school, you gotta go to 4 years. Everybody ain't trying to do 4 years.
Right.
But still, you'd be able to get this moving forward. So I appreciate that.
With the funding too, it is really important here, so here, like recognizing the cost of care, the cost of incarceration. I mean, there are real costs to these things that if we could be more preventative, the savings alone should be able to support these things. I know that's a huge shift in our entire culture, right? We have this culture where we want to be punitive but it doesn't work. And reactive, but it doesn't work, and it just causes, I think, further damage to our economy. And so if people really want to think about funding, funding community health workers to get certified in something as opposed to paying for foster care for a child or incarceration, like, that's huge. Huge, and I mean, you can't even compare the two in terms of cost.
But I think also the fact, if my understanding of the system is correct, the reimbursement rate for foster care is much higher than for prevention. And
Yeah,
so,
it is, yeah.
there is an investment initially, but you can bring that. There is not that same dynamic when it comes to, if my understanding of the system is correct. When it comes to preventative health. And the other thing I think, yeah, guys have some really great.
We have a question in the chat.
But I would just say one thing, just to highlight the point about community health workers as well. I just wanna uplift that, I remember a conversation really early on in the work, I think Amelia Kircher like brought up that idea of like thinking about some of those ways. So I just, that aren't just, it doesn't have to just be, when we talk about flexible pathways, it also needs to be about like this piece, so I really just wanna uplift that like. That conversation had come up and I don't know that I saw that in the draft of the report, so really would like to see some of that.
And I would say, and hopefully, thank you with the utilization of them, because you can have these people to get it. But if I know Morrison Center or these big box organizations, I'm just gonna go in first with the easy, right? So if we also, if we're going to encourage people to get the certification and invest that time, we then have to pour into them and actually contract with them to bring, actually let them really come to the table. And so that could be like performance indicators. Show what percentage of this are we utilizing community-based organizations or what do you call it, community health workers?
Yeah.
Absolutely.
I think what you said is extremely important in a lot of ways. It's a microcosm of really what's going on in our economy, is that there are so many opportunities for people who maybe don't have the pathway to 4 years of college to do other things than go to college or get a master, get a degree. That could stimulate our economy, that could build programs outside of what we decided it should look like. And I run into that stuff in my profession as well. We're constantly looking for qualified people, but what they're telling us qualified people are, it doesn't match what really should be. It's just super important across the board thing.
I'm sorry, I'm just gonna ask my question in the chat, and then, so, Michelle asked, does this committee think that funding is needed to have an ongoing multidisciplinary advisory committee to keep momentum on sport?
I think that was, it's consistent. Recommendations made, there needs to be, a task force or an advisory committee, maybe some consensus on what the people and who's gonna be honest with, or make this move forward.
Does that require funding to have that task force?
I don't know.
I think, I don't think it requires a ton of money, but I do think it requires some sort of staffing of that. Like, we were able, because we got a little bit of money with this, to pay for 2 contractors to help facilitate this work. We wouldn't have had the capacity to do this, I mean, on our own, like, we could have tried, but having someone else where they had the ability to dedicate time to that and be paid for that work, like, I think. But it could be as small as, I mean, just put your, like, a position, like, I mean, we can start small, right? It doesn't have to be that, we need millions and millions of dollars to get started. I think there's still a lot of implementation work to do, and having something to support some people where they can focus on that is gonna get us more results. You can still bring in people from different agencies that as part of their job sit on this, committee, but I think the important thing is having somebody who is like running it. And without funding, that's gonna be hard.
I just think about some of the agencies or community members that they are giving up at their own time, they're not agencies that pay for their position, it takes away from billable hours. And so, in community members, if there's a part of it, if that's not sustained by your employer, then they only compensate them so that they can participate and their voices can.
But I talked to you about compensation. especially because I know compensation here in Oregon. It frustrates me that if I want to volunteer or do my time, that somebody else has made a decision what my worth is. And so there's a line about, if you, above this line, you can't, well, then you don't want me, that I know my worth.
Yeah.
And so it's about the compensation is good, but you have to be willing to give people credit for what they bring into the table. And unfortunately, we not get that.
And again, there's statute now that says it's the per diem rate of our legislators.
Yeah, I think it's also, right, I think she's also speaking for
For 1 day, 166.
178 now.
Oh, 178 now.
Or 8 hours.
right, but that's also if you're under a certain
power.
Yeah,
There are
So,
times
yeah,
that tell me to give
I
away.
mean, that's the community.
I think that's the minimum, though, I think there might be some language that an agency can choose to go about, if they have the resources to do so.
Right.
But that's like what the statute says that we have to offer,
Right.
so, again, having funding so that we can go above and beyond that if we need to.
But you're right, there is you have to do forget what's outdated as well. But when you're doing that, because I know with that condition,
Mhm.
if people who, are either paying full time or they have, well compensated positions, then they don't qualify for that. And then also, a lot of people are seeing, I know this has happened with, APD is some of their commissions, is that people who have benefits and disability benefits, and they're sitting on a commission, they risk losing their benefits if they take that because it's
Over the.
it puts them over the edge. So I mean, there's all kinds of things to be taken into consideration if they accept that particular compensation.
So that impacts your ability to get people qualified, to do what you want, because you got all these other pieces.
Right, and especially if you're holding, like you were talking about, and it is a huge commitment that you guys put in. But that's asking someone to volunteer, was it 2 times a month or?
This particular committee was twice a month, 3-hour session.
Right.
And they met separately as work group. and-
During traditional workouts, not after 5,
Yeah,
not on the weekends. So again, those things are prohibitive of a lot of smaller, organizations supporting to or to be at the table. It's just, it doesn't allow.
It was about the commission, so. Just thinking about the governor's child foster care advisory commission and not only have it.
so then we had a question.
Oh.
I might have circled back to.
Yeah, no, I feel like I'm hearing everyone talking and the ideas that are coming up are great ideas. The points that are coming up are great points. When I go back to, when we talk about pathway certification, there's an underlying bias and all of the policies that tie our hands, or tie your hands. And we can come up with a beautiful, plan and recommendation. But we know that if biases aren't like really addressed, then all of the hard work, it's gonna be difficult to implement. Because we see it in other areas. So when we talk about certification, when we talk about trauma-informed, evidence-based, who has decided that those things should be used?
Mm.
And 9 times out of 10, the people from the community were not at those tables when you talk about trauma-informed, doesn't say much about race. Doesn't talk about the dynamics of the history. We look at our political, I know unfortunately have to talk, like our political landscape for the population that we're talking about. Where they're, instead we said being race, right? So how are we, and I don't know, like, that's a really big question. I'm not saying we can have the answers necessarily to it, and I don't want to damper anything, but how are we thinking about really getting out people are implementing
when they have their own stuff, that no one's calling them on, that they're not even working with. I'm hopeful, I'm cautiously hopeful.
Cultural brokers and basically people that are in the community and from the community that can help be that person at the table that's not advocating.
I'll take it back. I'm a cultural broker, but I don't, I'm not invited to the thing.
As a cultural broker, yes.
But
In California, we have child family team meetings, right, where we tend to have cultural workers that are part of those meetings. So that way the family isn't feeling like, you know, it's no wrong, it's too much, it's like I was from the community, but literally can be like, oh, we have the clinic on the corner and like we could just get child welfare to right?
Believe it or not, we did that,
And I.
We did on Iowa, because
absolutely, so the community has stepped up to fill that void, but it's not, it's not a place at the table for that. But the community has stepped up to fill that, absolutely. And I would say about, cause, you know, I was saying that the break and I'll share, I hear a lot, and I work kind of boots on the ground with families who are in the middle of the system, who are, you know, working either to prevent their children from coming into care or working to, get their kids home, as quickly and safely as possible. And we hear a lot about, and we see in the taglines for trauma informed or cultural informed. And that's ambiguous because that's defined by who, right? If I am the recipient of the trauma informed, then I get to say if it's trauma informed or not. You know, I was just saying to Ms. Deborah, like, punish her, because I just helped you. If she doesn't see it as helpful, I didn't help her, right? Or if I give her a lawnmower, I said, I just helped you, look, I did that. Right, these are extreme examples, but that's what I mean, like, we can't tell ourselves that this is trauma informed or culturally informed based on our measuring stick. We have, and it's different for each person. You have to check in with that person, and I need you where you are. And my intention is to be trauma informed. What would that look like? How would I show up for you as a human being, right? We're not a monolith, everybody's different. And so I wish we would, do more with those buzzwords.
So I'm thinking back to Oregon, that meeting that Jeff presented at. Couple things that he's is out of North Carolina that has done Oregon's field just for a long time, and two things he said really come to mind as you all are speaking. Like one example, you know, because he still works with kids and families directly as a clinician, and he gives kids a 5-question assessment after every session where he sees them, where they get to tell him, did I listen to you today? Like, did you feel understood by me? And like, that's just a really small example, right? But when we're talking about what does trauma informed look like in action, like, woo, the kid who you're supposed to be serving gets to tell you if you're doing a good job, like, that's it. It was just like, what a poignant, relatively simple thing that is so empowering. And I think he also kind of spoke about, you know, we need to look at evidence-based model, like we can use that information as one piece of information, but we also know that supporting those people is like just as important and effective. And I think gotta balance those things. So I think those are like thinking about.
I met Jeff as he
Yeah.
in April, and I was like, you have to talk to this girl because I'm just. I think it's consulting very good, you know.
Yeah.
Sorry for the interruption, Justine.
No, I'm perfect. You can call them.
Michelle, is her name?
Yeah.
You over there?
No, she's not.
She's been quiet.
Yeah, I was wondering, I learned, Orange and San Diego County by participating on the Olympics. And what we did, we extra compensation, we did get, modified years ago to be able to vote for that, and then also excuse $1,000 a year. So in court a lot, and if I wasn't testifying, then county council would excuse me from being there. If I, but the CJAC task force especially.
Yeah.
A lot of time, a lot of middle of the night, so being there at 8 a.m. for just that, difficult to do.
Yeah.
But like, SOP was pretty easy. I love to do this practice myself, but I appreciate it too, when I work through, and speaking to my peers about like, it's really not extra work. Once you know how to write out your reports this way, it's easily reflected with PHR and this reports. I felt like that was helpful, so I just wanted to know if the task force was created, would that be something that you guys would
I
take
think
off?
that's a great idea. I also am thinking about, we kind of have a framework with big book cases, and we've created some units where we've allowed for some life adjustments to caseloads and things like that, knowing the additional work that has to go in. It would probably require some negotiation with the union, right? Because we're gonna be real clear about what we're gonna do, how we're gonna determine it, you know, all of that. But I think that's a good point, that if we wanna have these specialized caseworkers, we want them to be in community, you know, focused on these issues, we have to take that into account. It's not set up now for that, but I think it's something that you absolutely.
Michelle, do you still have a question?
No, sorry.
Yeah, and you can do the preventions. I know there's a couple, I think. Well, they've actually launched like pay for success pilots in Oregon. Is that, pay for success programs are originally in Colorado, where you have a program that is trying to be more preventative to reduce government costs. Because we know that like foster care is very expensive, or incarceration is very expensive. And so you get private philanthropic dollars to give the upfront investment, and then once certain results are met, certain KPIs are met, then government pays back with, because it's, you gave us the money to improve the program so we can reduce our costs. And we now have money that we can pay you back for that initial investment, but long term, you've now built the systems and processes to reduce long-term costs. So it will save us in the long run. But we just, government just didn't have money up front to do that, so they got private dollars to do it. Colorado's done a bunch. I know there's one in here in Oregon around in juvenile justice. I think it's all like in feasibility studies about how to do this. But in the exploring the like, what is the funding landscape and how to use philanthropic dollars and private dollars. In addition to the KPIs of getting private dollars to meet certain outcomes and then be able to, yeah. So it might be something on paper, I guess, but it, I don't really like have to pay for that kind of like funding model is, but.
And if you know the structure of the Colorado legislature, is it, are they full-time or part-time? So you have part-time legislatures in Oregon do that. It's a real change.
Yeah. Okay, yeah. It's fine, so.
Not to say it can't work, it's
Yes,
just,
but there's.
they're balancing priorities and influences and
Mhm.
different things.
Yeah. And so spend time reading history about the new governments for governing board report.
Oh, yeah, oh, it was started this year.
Yeah.
You have legislation about legislation about this.
Yeah.
About this very-
Every year, it gets like, we just had our, it's not big, there were like 3 1,500 bills, like every session, it's more and more and more, and it just is like, at some point, you can't reasonably even process that much information, and I don't know how we change that.
Sometimes just a change. With the lines of change.
Yeah. Yeah.
So it's.
Yeah, and then we have competing legislators all wanting to do it their own way, so there's 10 bills to address one in January.
Those are the ones we did this morning.
Oh,
The 10 minute chat was, oh, yeah. Well, she did, she added into the chat.
Oh, she did.
And so when we have our next break, though, we do encourage folks to walk around.
Yeah.
And read, since we didn't get to speak on them.
The one thing that's interesting as we've been in this room is we keep talking about prevention. And, I have history in child welfare. And I remember when I came in child welfare, there used to be preventive and restorative. And some brainchild within the organization, higher than my grade, honestly, decided that that wasn't necessary. And it's interesting to me, and we don't learn from ourselves sometimes. And it's like we keep creating these new nuances where it's like, but it was working, and why do we need to take them? Because part of it, to me, is kind of like, will we be where we are now, had we allowed that to remain in place? You know, because I think when you do preventative or restorative care, but then it's like, what can I do to allow this child to be with that parent? So that we don't have this commodity of we gotta get people in to take care of these kids. The other question I have, and this, hey, if you don't want to answer it, it's fine. Who decided to call foster parents resources? Because, and here's why I say that. As a person and out of humanity, resource makes it sound like it's a commodity. These kids are not a commodity. They are looking for family. So, I mean, that it just calls my skin to crawl when I hear resource, because again, we're making them less than human beings.
So I hope that you're upgrading from foster to resource.
Yeah.
Really there.
Yeah, it was nice. It's kind of a national trend. I think it was trying to go on scouts.
They not need to get all these.
Yeah.
You're
I want to talk about, because I hear what you're saying, and I think that is a very different perspective than what people thought, and that was that resource parents would not just be there for kids, that they could wrap around families and support families, and so, but that is such a different perspective and how it looks at it. We've talked about transactional versus transformative work, and it sounds transactional when you hear that resource.
Yes.
Yeah.
We try to take away from the actual parent.
Oh, do they
As a social worker.
It's a, do another placement, but I would have to, because I'm like, you're not gonna.
Guarantee it was.
You're not even reading.
Doctoral thesis and this.
Oh,
yeah.
Well, I know you knew we're setting up a resource parent, and also made of resource parents who are driving it. There's a lot of people on there do not have the name resource parent, so it's very interesting to see. But that's what, since that's what it's called, then that's what we, you know, they're like, so we'll see what comes out of it. It's only had 2 meetings, but it's not to be driven by child welfare, but to be it's kind of coming out of the foster care unit and the champions. So coming out of that, of the recruitment retention piece, but attempting to be a place where the voice of foster parents, resource parents is heard, and they can bring their own issues around receiving training, around receiving the assistance they need from and just the issues that they're facing with children rather than
driven by child welfare.
Basically, what you're telling me is you're talking about a foster care,
Support.
yeah, that's all it is, and that's, I've done those, so I mean, that's what it is, let's make it easy. Y'all make it complicated, make it simple. It's
No,
foster
we're trying to
care
make it.
support group in which they can be able to come together and talk about the issues that impact them. With hopefully somebody from the organization taking their information back and doing some changes in direction.
Right, exactly that, and also issues that may, families in general may face, bring back to child.
Yeah.
Yes.
So see, that's the thing too, is it's a thing where we don't engage the folks who are actually doing the work or who's being labeled. Right, if I've done many foster parent, AKA resource parent, foster youth, AKA lived experience, like so many different like trainings where even like foster parents, like y'all are not listening to us. Here are these things that we need, we're not being resourced the way that we need to be resourced. But language is being changed and models are being developed and everyone's feeling good about frameworks, but the people who are affected, regardless of whether it's direct service or whether it's the people in the organization or supporting the organization. So, you know, I think it's critical for us to, everything that we're coming up with, that you all have come with and are coming up with, is that the people who are affected need to be not just included, but we're talking about meaningfully, authentically, we talk about it, but then the shifts that need to happen. You know, we talk about time of day of meeting, places of meeting, compensation. We don't, y'all, right, don't track those things and all the beautiful work and all the other things that we're talking about. We're gonna be back. Yeah, right, so I just, it's doable. I have models and stuff for how to do that, it's just how is it being really done?
And that's, I feel like, one of the things I really appreciated with the group was having families who had experienced children being either in their home or taken out of their home because of sexual behaviors towards their siblings. Like them being able to come in and us to hear their voices, and I wish we could have done that a little bit more. I know we only had the 9 months and we were real busy, but like my hope, or one of my hopes moving forward would be that if there is some sort of task force, or if there is something that continues to meet, that we find folks who have that experience and we listen to them, because I think a lot of what they were saying, there was so much overlap about needs and where they felt supported and where they felt really left down. So I would love.
And to do something with that information, you know, because some of these people ask and they do, and then
Nothing changes. Exactly, and that's kind of like, yeah, that would be the fear, right? It's like, okay, this is the same or normal, but like, yeah, having their voices there, I think really speaks, okay, like all of the people who are experts, or all of the people who did schooling for this or whatever, like that's important. And I think what's really important is listening and, okay, what happened when like we act. Taking those points and really divide.
Taking great notes. Any other final points for discussion before we wrap up to set up for lunch? Anything that stood out?
I think we needed another work group, or I guess,
Yeah.
maybe this work, like this conversation, I had everything. Because I don't know what I don't know.
Yeah.
And I'm learning a lot about, you know, what resources are already out there that we're not utilizing, that could be fascinating for the affordable, not just in this, but in other things too. So yeah, maybe more of free work, watching. And we don't know, so. But and this could be great information for the next iteration, whatever that looks like, bringing people together and getting that information out ahead of time, so we know
Yeah, I think for reflection, also what might have been helpful would be like at the beginning of this. Everybody going a little bit more into like their position and like what, because then like. We would have better understanding of who's at the table and like who we can lean on for X, Y, and Z. And yeah, I think in retrospect, that would have been something that I would have wanted to really understand why was this group, because everybody's kind of picked, right? Like, and for a reason, like it's a double blind picking, like it's really about what they're bringing, so knowing.
Something else I think going forward is maybe thinking about the geographic representation, so we know there is so little now just having moved to Southern Oregon, realizing what a deficit of a, yeah. But and even further south, how just a deficit of resources and it's surprising. So finding what's happening in Eastern Oregon and Southeastern, Southwestern, and maybe having at least somebody. We talked about this in our group when we were trying to gather what kind of resources were available, what kind of therapeutic resources were available. We were like, oh my gosh, well, there's really nothing here. And I would be calling people down there. And hey, there's nothing, or who would they call? Yeah, you know, so it's like, well, that's probably, but, as we begin to gather that, maybe we need to have people who are in different areas of the state who are representative to bring us all together. It's like, this is how to get into, take this issue on more this.
Yeah. We definitely talk about that group as well, right? So like double-edged sword too, because Robbie, I think, did such a good job of like elevating like those needs that like also someone from Eastern Oregon doesn't want to, you know, call someone who lives in Portland for help, right? They want someone from their community. And so I think I think one of the tensions we talk a lot about is like, well, we're talking about statewide response, which we need, right? We should have consistency, like everyone should have access to like the same level of care and support. But also we have to be flexible and like let communities figure out what works for them. And I think that tension is really hard. I think we struggled, I think you really struggled with, and we'll continue to struggle with like finding that balance.
The one thing that I'm sitting and listening, another group that I don't see is you don't have a lot of work around intergenerational. And a lot of these kids may be with biological parents, but there are a lot more kids that are being raised with extended family members. And that would be extended family members that are just older siblings that are now young adults and are parenting. This is all new to them because they were just trying to live life. And now they're finding self-parenting their siblings. And somehow you need to look at, especially for communities of color, intergenerational is a big. There's a lot of families that are now having their young adults move back home because they can't afford to live on their own. And so how do you bring in and take in that component of the societal changes that are also impacting the family changes and dynamics as we deal with, you know, all these different issues.
So we'll break for lunch and we got some folks who have some information about their organizations to share and things like that. So we're gonna break for lunch and get some of that reorganized a little bit in here.
Something else about that? We're gonna take about 10 minutes to set up for lunch. We didn't want to be disruptive because it's so quick. So, once Shannon finishes, take 10 minutes to all stretch, and then when you come back inside, you'll have some. Okay.
And we do have some small thank yous for our work group leads. We're just
Yeah.
So thank you all. We'll continue in this.
Yeah, she can, anything you want, actually, anything you want to start out. I was looking at this, because, I tried out more. Yeah. It's like. Yeah, she did, that's what she said, and I saw her, and I saw that side of me.
Um, and- ooh, hello, recording. And what I put out as a request for there actually to be presentations on the recommendations in the Judiciary Committee, and maybe addition to a Human Services Committee. Still waiting to hear back on if we'll be able to make that agenda or not, but I know there are multiple legislators that are very interested in both the jurisdiction and the CSB recommendations. I know many of them are particularly interested in hearing from committees on what order recommendations should go in, or that like the committee has thought through. Are there some things that maybe the committee is suggesting being passed in this short session, and then more work to be done ahead of the long session in 2027? The short session is starting in February 2026, just for your awareness. But people are really trying to understand, now that you have done this work for a year and it's very intense, what are all of your thoughts and considerations on implementation of recommendations? Again, like, does something need to be done before another? You guys have talked and are pretty attuned with the fact that we are not going to have a lot of budget flexibility. And so what can we do to keep momentum on this work for things that maybe aren't going to cost the state or legislators a lot of money to implement, but continue to make change and hope for sunnier days or more more affluent times for our state, with less uncertainty about budget, to be able to fully implement some of those recommendations. So those are some things that I am aware of. I'll pause there. Lisa, is there anything else you wanted to mention about kind of those big next steps?
I do think for some of you, if I would encourage you to, if possible, consider speaking up during some of those hearings and testifying about your own experience with the committee. And, you know, it's just been such an honor to sit with you all today. And I know I see so much commitment. And so I would love for, I mean, I'm touched, Tim, that you even mentioned that your kind of approach with officers has shifted a little bit as a result of some of this work. And that to me is worth everything that we've done over the last year, is that if we've just even slightly adjusted some people's mindset around the fact that, you know, everything isn't always black and white. We don't always have clean victims and perpetrators of these types of things. And so hearing, I think, from you all, I mean, we'll definitely, you know, our facilitators are going to be presenting their findings, but I think if any of you are available and interested in signing up to provide a little bit of testimony about the experience and your recommendations, I think that would go a long way. So that's the only thing I would add.
Even if that's not something you want to do publicly, talking with your local representatives with the House or state senators is really powerful, that for them to understand what could some of these recommendations mean for their constituents, for people that they are representing and serving. You know, like I heard some stuff about like the kind of sounds like a desperate need for services in Southern Oregon. Do those legislators know that? Do they know what could be that some of this work could impact their community um, profoundly if they have no services available for kids and families? So I would love to help connect you with any of those folks. I will just say it is become very apparent through some of this work on both the Judiciary Committee and this committee that it is not a helpful perception that child welfare is dictating or has predetermined the outcomes of this work. And so I will help make connections in terms of giving you emails, telling you people who you can connect with that are interested in this. But to really make a difference, people need to know that this is coming from all of you as subject matter experts and from community, not that it is something that child welfare is driving, because then the narrative becomes we're trying to shirk our duties or we're trying to do, something and not serve families. And that's not what this is about, right? I think all of you know that this is about how do we best serve kids and families through a non-punitive process that really gets families and youth the services that they need to engage. And so I just want to call that kind of elephant out in the room that I am happy to help in all ways. But me being in the room isn't like that is going to have a connotation to it that I just want to state. So however I can help, I do know that we have with the System of Care Advisory Council, there is a family and youth advocate. I know they are always willing to kind of help people if they want to meet with legislators and kind of guide them through that process and kind of be kind of a support to community advocates. So if that is something some of you are interested in, I'm happy to give you some connection there to get a little bit of prep and think about how you might want to engage with the legislature.
And even, I think written testimony too can be powerful, sending even an email to your legislature. Or actually, when the hearing comes out, you can still provide written testimony as opposed to necessarily having to get up and speak for the legislature, because I know that can be a little intimidating and sometimes your employers might not to shy away from having you kind of be present at the legislature advocating for something. I appreciate, Michelle, you kind of just calling out the sort of elephant in the room, and I wish I had come to this group, I think, before I did in April, and I think for some of you, when I came in April, we're like, what's going on? Like, because what I would get was little pieces of information, from committee members or things, and I know there has been some narrative, and I don't know if it's always been in the big group in this space, or some of the work groups that DHS just doesn't want to do this work, and we're just trying to get I promise you, I'm not saying every DHS worker is great, but we don't come to this work to try to get out of it. It's because we're thinking about what is best for children and families, and our system is not always what's best. In fact, more often than not, it's not what's best, and it causes more harm than it actually heals. And so, we know that we have a responsibility in this, but we know we cannot be the only ones. And so, I'm really appreciative to those of you who are still here, who are sitting here, who showed up, because I think there are gonna be some members of the committee who maybe are gonna say, no, I don't agree with that. And, you're never going to get consensus, you're never gonna please everyone, because what pleases one person might not please another person. And that's okay. And I mean, we're definitely willing to take some of the critique. But I will stand behind the fact that if there's a role for us to play in this, and I think there is in many of scenarios, we're just wanting to clarify, what is our role? What is the law enforcement role? How do we work together on this? And how do we make sure that there are other options? This is the last thing I'll mention about my own lived experience, but I shared with y'all in April, I didn't disclose because I was told they were have to call DHS. Kids know this stuff. Kids know what's gonna happen. My family's gonna get broken apart if I tell. And so, had there been other options, I probably would have talked. I probably would have got support. And that's where my passion is coming from. It's not a place of like defending DHS. Trust me, I didn't grow up in child welfare. I came to child welfare about 12 years ago, having done a lot of work in the private community. People said, "You're going to work for who?" And I said, DHS child welfare. This was in Iowa. And they said, "They hired you?" And I was a huge critic. You know, it's easy to sit outside the child welfare system and say, y'all don't do a good job. You don't, you can't win in child welfare. You're either not doing enough to protect kids or you're harming families, right? You get criticism from both sides. So it's not easy work, but I feel confident in the fact that our leadership, our program managers, are down to our caseworkers, are doing this work because they care about children and families and we want good outcomes for them. And so, I think it is gonna be really important to speak to that. Like, and I'm telling you, Nish will tell you, I have been hands off on this. The only thing I did with, I'm not gonna call it literature abuse, I know how that. I'm gonna call it the review document. The review document. So like, I mean, I changed, like anything people were upset about had nothing to do with us. Like, I just was like, oh no, that's actually not what DHS does. Like, it should say this, And then it became sort of this narrative like that we changed it or something. And I get it. People don't trust us. I didn't trust us. Sometimes I still don't always trust us or think we're the right people, right, to show up. But I really encourage people not to be a little less cynical and a little less skeptical about everyone's try to assume positive intent. Like, I mean, we didn't bring all this together to basically predetermine what the recommendations are gonna be. We did. I mean, and I hope you see that when you look at this report. I hope you see yourselves in it. And I hope that you can continue to spread that message out in respects.
I have
What I can say is that it was, I think it was more about timing. Because all this work had been put in and it kind of left the impression that, oh, we just did all of this, but so maybe if it had been done early on. And the conversation started then, and it just, well, it wasn't you or the issue. For me, it was just like, oh, well, shit, we just did all this work and now, well, really, what are we doing here? So it just kind of felt, it threw my compass off.
Yeah, and no, I mean, I don't take any of this like personal. And like I said, I'll defend DHS when I feel like it's warranted, but I'll also acknowledge when we don't always do the right thing. Like I said to before, I'm sure every one of you knows people in your profession who don't always do the right thing, right? And so, but I really want you to know, like I said, there were very few things that we even added to that. I think what it was is there was feedback coming from all of you independently, and so they're trying to put in information, synthesize all of it. I know even with this final report and not knowing maybe where everything's supposed to be stored, right? Like, I just want people to assume good intent, really, we wanted your expertise. That's why we even did the sort of blind review of applications. We didn't want anyone to believe that because that was some of the folks who are very skeptical and untrustworthy of our agency said, oh, you're just gonna pick people who are gonna do whatever you want them to do. And I'm like, first of all, good luck on that 25 people list that was in the legislation, finding somebody from every one of those organizations who's gonna do exactly what we tell them to do. Like, sure. But we didn't even want to know the names of people. We just wanted to know, are you committed? Are you gonna show up? How are you gonna bring this back to your own constituency group and bring that information forward? That was what was important to us. And so we have tried at every step of the way to make this your work. And I mean, so much, that we don't even have a child welfare. I mean, Ellen's child welfare, but Ellen's kind of, she's a little on she's not like child protection, right?
She's a little, we love her. We love her.
Yes, we do.
But she does like work with committees, right? Like she's not the CPS expert. We need to have like a CPS expert. I mean, Veronica is, but she's a non-voting member. Like at the table to talk about what was really geared at child welfare in this bill. And so we have really tried to say we are, we are yielding power to these multidisciplinary voices to tell us what the system needs to look like. And, we can define DHS's role in that, but we also need to figure out what everybody else is.
I got a couple of questions for the group, for committee members. One of those is, have you envisioned what it could look like to take some key recommendations that you have for, I'll specifically, like this morning I heard there would be specific recommendations for OHA and there were specific recommendations for CACs on like kind of visioning of what maybe things could be different. Has there been talk amongst your committee about setting up conversations and like presenting on the work that was done and those recommendations that you've come up with members of the leadership or multiple CACs across the state when they do kind of their convenings?
No. Anyway, short answer, anyway.
The conversation. Fair. I mean, I think, I don't know if you can see me, Michelle. Hi, it's Jessie. When you said one of the recommendations, do you have a dog? Are you being attacked by a dog? Are you okay?
He's humping a pillow behind me, so I was trying to get him out of the way. Sorry.
When you said, recommendations for the legislature and things that are not gonna cost a lot of money, I mean, I think one of my big concerns is I think we need a human, which is not a lot of money. I don't know what a lot of money counts as the legislature, so I think to kind of to your point, Lisa, I keep sort of saying like, we would love to have this be in our unit. We keep kind of having a conversation around moving things from punitive toward treatment. Treatment lies in our unit, so I keep sort of offering. And I don't want that to be like, I want to own this, it's not a power grab, it's more of an offer, sort of coming alongside DHS as opposed to like, you get what I'm saying. But so if there is an opportunity for it to be led by a person, I would like that to be a recommendation, because I think to your point, Michelle, my fear is we get a report, it has recommendations in it. I think those of us who work at the state level, there's a lot of reports, we all know this, and I don't want this to be a report that then just goes and sits on a shelf and everybody goes, ooh, nice report, and that is the end of it. I think that this needs a person who can own and say, okay, here are the next steps, how do we actually implement, and to your point, like, how do we get in front of the next audience? How do we bring this to people? How do we kind of move things forward? Do we get a steering committee? Like, what does that look like to sort of get things, what the next steps look like? So we have not done any of those things, but I think that those things need to be done and someone needs to own that.
Just out of curiosity, Jessie, like I could see you owning that potentially for how to communicate up to OHA leadership or broadly about the recommendations and helping some of these committee members have voice. There is a member of a CAC here, right?
Yep, Justine.
So hi there, Justine. And I was thinking kind of the same thing. Like, is that something that you could take the lead on, I don't know if it's like the child abuse solutions or when all CACs get together, but being able to bring and present these recommendations to them as well that are specific to CAC engagement. I'm just trying to think of like, we naturally have people on the committee that can go back and maybe they hold their small responsibility for how things get communicated to their community that they're representing on the community their community that they're representing on the committee. I just was trying to think that through because it's when I was hearing the recommendations, it kind of was like different pieces. I don't know if there was a law enforcement one in particular, but still like how can was it Tim? You're from law enforcement?
Sure.
Yeah, so thinking about like how like your shift in thinking, some of the things that you learned, some of these recommendations, like how can you help your other law enforcement partners or what is the venue to communicate some of these changes? And then I think my follow-up question as we think about that is what do we need to be prepared for where we may experience resistance on some of these recommendations?
Yeah, I guess I can say on kind of that idea about going back to CACs, like I think that question obviously kind of remains in the report and is something other CAC folks who aren't here today but have been on the committee, like we've had some conversations with OPAS as our state association and keeping them informed about the work. And so like that's one of the things I feel really happy about that like this work group has led to of just like more conversations happening in that space. I think in order to like say that I'm gonna be responsible and, do that, like, I think I need a little bit kind of more clarity and agreement about like what. For some of your questions, Michelle, right? Like if I'm saying these changes are gonna be happening, I guess I don't know that you're at the point of communicating that really clearly. And like having the messaging that's not gonna be more confusing. I guess that's one of my fears is that then we all go back to our own systems and are not aligned in what we're communicating because there's still a lot of gray area and question. So I would say like, yes, in theory, at some point, I don't know that at this point, I feel comfortable or ready to like commit to doing that.
Yeah, curious about that. So, something that I think might be helpful for readers of this report is to understand what is something that people have the control today or the authority today to change practice for what's recommended, what is going to take a legislative action to change law or to get funding, and then within that, kind of what is attainable short term, and then what do we need to work on long term? Because I think that's what helps kind of chart the path forward, right? If there's things that we can, like if there's things child welfare can do within our authority control, then we should be having the conversations internally about how to do that and on what timeline and communicating with partners that may be affected by those types of changes. And I guess that's kind of what, when I think about implementation, I think about how do you categorize, how do you kind of chart a path forward? And that you may not be at that point with this committee. And then I guess my question is, what do you all think about asking the legislature this short session for there to be a legislative mandated council, committee, task force, whatever word you want to call it, to keep the work going? And maybe that's the next step. I want to hear from you guys. Where do you think the energy should go kind of in the next 6 months?
I think one of the things that's really important is to make sure the legislature doesn't come up with more unfunded mandates.
Yep.
Absolutely.
Because we already have none of this, so I think
Yes.
maybe having a working group moving forward could prevent that.
Yeah, I mean, in the report, the timeline, the phases that you all worked out, the most immediate is to set up a task force, so.
Yeah, cause I think like to what Jesse was saying, like we have a good like draft report and like there's still some lack of clarity around exact recommendations. And so I think the thing that we all don't want, at least with folks that I've talked to, is like to leave here today and be like, okay, we're done. It's like, no, this is just the next step. And I think it really makes a lot of sense for the next step to be like a specific task force for then furthering the recommendations. And like what's
So-
real, especially in regards to funding.
Yeah. I love this idea. And do I have permission to kind of run with this for a second? On kind of what would need to be done logistically to make that happen in short session. So in short session, no state agencies have any bills. So this would need to be a legislator taking this concept and putting it forward as one of their bills, or a committee dedicating, I think, one of their couple of bills that they have in short session for this work. So talking with a legislator, getting a legislator to buy in to have this be one of their bills in February, that would be step number one. Second is really mapping out the scope of what do you want the statute to say. I know I put in the chat earlier, there are other like commissions, like, the foster care commission that we could model after, if that's what you're thinking. If you know of another council or committee that you want to model it after, then you got to think about, what do you want the scope of work to be? How do you want that defined in statute? How do you want attendance to be defined in statute? And what do you want the deliverables and the timelines for deliverables to be in statute? And so those are things that I would give to this group as kind of like the next key steps to outline to make that legislation happen in February. And ideally, that needs to be like baked language, a legislator totally on board, and like it being circulated with other legislators that this is happening in like October or November. So there is not a ton of time. One of the good things is, like, if you hone in on that, I would encourage all of you committee members and community members to attend the testimony or the presentation that happens in September. And just show up, even if you aren't invited to actually speak at that, to show that you're here dedicated to seeing this work move forward. Again, meeting with legislators right after about the importance of having a task force to continue this work, to continuing working on refining the recommendations and implementation plans, all of that. And so just that's what would need logistically to be done. Again, I'm happy to help be a barrier breaker or move things or help people make the right connections to different folks in my role. But again, like, it would need to be led by committee members moving forward, and not necessarily child welfare. Oh, hello. I can see your hand.
I guess maybe I'm just a little confused on the process, because maybe, and I don't know how that works, but I thought we were like already there. That's what the point of this group was. I didn't know that we were then submitting it for asking them for permission for what we were doing. Like, I don't know how that works, but I mean, it's like, what if they say no? Well, then everything that we just did was for nothing. Like, I don't know how that process worked out. I thought we already had the yes, and this was.
We had, here, I'll try to answer that again. Like I said, we actually originally went forward and asking for a statute change around third grade. That was the original. It ended up being what we call a gun stuff, like took it all out, replaced it with we'll give you some money, do a couple committees, come back to us with recommendations. There is no, they didn't give us a, we'll implement whatever you say. They just said, go study this and come back to us with some recommendations. And, you know, depending on what the circumstances were when we came back, I mean, things have changed dramatically in the last year at the federal level in terms of funding, things like that. So, you know, the only thing we got a green light really was to do these committees and bring forth recommendations. I think it's really important. I don't know if you guys spent a lot of time on it. The jurisdiction talk they had at their last session, for those of you who might be on both, talked a little bit about implementation science and talked about how much it takes to actually get especially system change, right? I mean, we just think, we actually had laid out like a Gantt chart of just a policy change when it comes to doing some work, pre-work, like the stuff Michelle's talking about, to actually getting a bill across the sponsor, to get it introduced, to get it passed. If it has funding, to get the money actually allocated, you know, because typically there's a few months before the next fiscal biennium, whatever starts. And then if it requires contractors, there's time in that, and if it requires rulemaking, like there's all these steps around implementation that can take years just to get to a full implementation of one major policy change, right? Let alone kind of what you all have put forward as recommendations around multiple systems. So I think it's actually pretty wise, one, given the financial situation of the legend, you know, where we're at fiscally, to say, you know, we want to go now the next step of like, we've come up with these recommendations, but maybe we need to do some more work around feasibility, planning and implementation, sequencing, what it would take, what, you know, what are some of those quick wins as opposed to the more long-term stuff. 9 months wasn't a lot of time, to be quite frank. It was, I mean, you all did tremendous amount of work in that time to get this to where it is, but I think having a little more time to, now that we have the recommendations, actually get beyond that high level to more like what you're talking about, Justine, the more nuance, the more details, the devil's in the details, to get into the weeds a little bit and start thinking about what would this actually take. And then whether you're more ready come long session to ask, to make an ask, or again, it needs to kind of, like, we got to do some planning work. I know it's hard because legislators think in 2-year cycles, right? They want that win, they want to tell their voters, look what I got, but as you all said, you all work in these systems, unfunded mandates, it doesn't help, right? It waters down all of our work. And so I think every opportunity we can use to educate legislators about like, look, if you want this done and you want it done right. I don't know if any of you heard me testify when we gave them the update in September, but State Representative pushed on us a little bit and said, why don't you have more? And I said, you know, getting contractors, getting committee members on board, that takes time. And we'd rather do something well than do it fast. And so that's where I sit. And I think this is actually a pretty wise approach to say, we just started the work and there's more to be done. You know, I think you could even write into that, like if people who are on this committee want to be a part of that ongoing task force, that we can kind of look to you all first. And then there may be other opportunity for, you know, different people to come into the conversation. But I mean, I just think realistically, knowing where we're at financially, like we're not gonna get big money to suddenly pivot this entire child serving system in a year. It's not gonna happen, but
I have a question. So given the timeline and all the different things that need to happen, you know, that you just said, would it be possible or make sense for a community organization to actually be the one to take the lead and be supported by the different agencies in getting funding that they need? I mean, my experience working with community organizations, not that they should have to, but they do a lot with a little. And they pretty much are the ones holding things up when everybody else, you know, is not necessarily looking. So is that a possibility to identify a community organization who's already doing the work in the community, who could then take the recommendations and then, you know, start implementing in some way with the support of agencies, helping to give them funds as opposed to the other way around?
it depends, like, I think we always have to be careful of procurement laws, right?
Uh-huh.
Like, sometimes you can get somebody to pass in legislation pretty prescriptive, who's gonna get this money, right? Like, we all know that the earmarks and the things, right?
in our situation, we were just told we had this much money to contract with an external facilitator. But even then, we had to cut some corners because we didn't have time to put out an RFP and wait for responses, right? Like, we had to rely on like, you know, doing sort of a landscape of like, who maybe knows some people who could do this work, who've done similar work in other jurisdictions, and, you know, honestly, we were like, hey, Denisha, like, what do you think about this? And I have to say, I think, you know, yes, they came from California, and yes, they don't quite understand Oregon, but I'll be honest, sometimes I don't understand Oregon either. But I think they still did a great job of trying to listen to all of you and bring you all together. And so it could be something like that, where it's like, you'll hire a contractor, or I don't know, Michelle, you might want to speak to this about like how likely it would be to be like, hey, legislature, you know, identify XY organization to lead this work. I do like the idea of the external, because like, to your point, Jesse, having it live in one of our agencies makes it start to feel like one of us is owning it, as opposed to having it be outside of our agencies. But I'll let you add any thoughts,
And
Michelle.
before Michelle, before you, I want to clarify too, when I meant about funding, when I'm thinking of a community organization, right, nonprofit outside of agencies, there are other funders that they go after, you know, that they, traditional funders, non-traditional funding, there are organizations that maybe some of the community organizations have a harder time getting funding, that having support of agencies that are in the room to say, we are partnering with them and they are the lead, and here's a letter of support, or here's some, you know, outside of what might be held up with the government money and stuff like that, you know, because we all know what's going on with that. But like, how can we think outside the box? Because as someone who has, you know, been in a community organization, trying to get funding from some of the larger organizations is an issue, right? Can be difficult, but if you have the backing of people, like people in the room, then that could be something completely different in the meantime. And then that gives enough time to be able to work through some of the other timeline and other logistics with getting funding from the legislators and stuff. But yeah, I just wanted to clarify that too.
You know, I have no idea what this legislative session is going to be like in February. I mean, I'll be honest with a lot of you, like there are a lot of talks and rumblings about cutting state. Like, even though we got money this last session for this biennium, there's talk about having to pull some of that back if things are going to be as bad as we anticipate with Medicaid cuts and with SNAP cuts. And so it's difficult to know even if state agencies will have general fund that they could use for something like that. I say that because I want to be realistic that we may not be able to actually get money like we did for this advisory committee and the facilitation, like we did in 2024. And so thinking creatively about how can we package like our ideal that is sensitive to budget constraints, and then having a plan B in our back pocket of, if they can't give us anything, what would we like in the 2026 session to keep this work moving and to not feel like nothing is going to happen until 2027, 2029, you know, like, it's an incredibly difficult time. And again, like, I think when the legislature is going to look at, should we have SNAP benefits or should we pay for task force and committees, they're going to say SNAP, right? Like, they're going to say we need to provide direct care to people. So it's a stark reality. I guess, like, I'm curious, Ellen, do you know how much the legislature has allocated to the Foster Care Commission? Like, I know you have your position through that, but do you know if there's any other funding they get?
No, I don't really know, because my position's funded through the foster care unit. And then it's the only staff position, although there could be others, you know, there could be other positions in the legislation, and it took them a couple of years to then actually fill my position. I think
Got it.
my position was funded in 2021, and they got me in 2023. And that's the only money we have. And
Yeah.
so, except that there are a few members that are now, for the first time, we have 2 members of the commission that qualify to receive funding for attending the meetings.
Great.
And it's for the first time, and figuring out how to get them paid was really a challenge.
Yeah.
And now
Yeah.
I go through DAS. So, I have some payroll specialists through DAS who I've woven around. It took me forever to find. I went, through almost all of, the payroll specialists, none in child welfare, so it just took a long time. So I don't even know what funds they're actually paid from, because it comes from DAS.
Okay.
Comes from other boards and commissions that also receive funding. But as far as our commission, it's just the foster care unit. Like if we have one in-person meeting a year, it's Stacy Lowboy's shop essentially, that then and her the PCA code and index number that anybody like lunch or whatever would be paid from. So there's no budget that I'm given or that I have any say over.
I wonder with the conversations around funding, I think we were focused so much on funding actual treatment, and I wonder if there aren't other funding sources around system improvement. I'm thinking, I know within child welfare, the captive, grants. So Child Abuse Prevention Treatment Act at federal level, they do both a captive basic state grant. Tammy's team, I think, runs, and I could agree to kind of just have a conversation about what that budget looks like. But then there's also the Children's Justice Act, which would run through DOJ. And I know that I think Child Abuse Solutions actually manages that funding. I don't know how much there is. But I think of those two because I think they often are geared towards system improvements. And so I wonder if there aren't, I just know those because I manage them in Iowa. And so I don't know if others with like OHA or OY, know about other sort of system improvement dollars, or improvement dollars, anything that might. If it's $100,000 and can help us look at potentially contracting some work out or something like that. What are some of those maybe existing resources? And I'm happy to kind of have that conversation with child welfare budget and look at do we have any options here? Should we not get any funding for this? But if other folks in other departments, want to talk with their budget folks and let us know, that'd be really good to know too. If there's some grant money that, these are basic grants where, we don't have to competitively apply, we just get them every year. And I'm wondering if there's a similar dollars to behavioral health or, things that we could maybe look to in the event we cannot get additional allocated federal funding.
Meeting tomorrow, that might be.
It's supposed to.
Would it be possible to have people kind of identify themselves of who may want to work on all the logistics of a legislative ask for this task force, trying to figure out kind of different fiscal options or organization options for that. I'm not here next week, but later in August, having some meetings and then trying to I'll also do some poking around to see if there are any legislators that are interested in championing something like this in this short session. Would that be a solid next step?
We nominate you, Michelle.
Well, I'm happy to coordinate it. I need to know who to send the invite to. If there's any of you that are dying to help map it out, think about grants, think about budget, all that, happy to have you there.
You can always include me.
Yep.
Like you were already getting it.
You can.
You don't have a choice.
Destiny's in too. You can, we can, pull in Robert.
Oh, that'd be great. I didn't catch your name in the front. You're in the front for me in white.
Oh.
Were you?
Shalita.
Hi. Are you interested? Are you part of our community?
Sure.
Okay.
We gotta make sure she's gonna pay you for your time.
Are you gonna give us
I
a money?
know. Well, you're talking about community organizations. I just don't know if we have the voice there, if we're talking just state agency people so far, so.
You can include me. I'll make sure, you get my information somehow.
Yeah.
Yeah.
Cool.
But I do wanna put in a plug that she is a community member, so it would be great to compensate her for.
Yeah. Yeah. Thank you for saying that.
Put me down.
Does Oregon do like regional or local tax levies?
Yes.
There is just, I learned a lot from that
Response.
response, yes, okay.
They're usually not big and they're not.
Yes.
They're.
Yeah,
taxes,
yeah.
there's our tax in Portland, they're basically targeting Multnomah, Washington Times.
Yeah, it would be hard to continue this in a statewide effort, which I think we all are very passionate about doing with funding from one area.
But I think that's the key is in the metro area, it's easier to raise money, it's easier to get advocacy.
Yeah.
And if we were talking community, it would be real great to have the community partner reach out. But the state is so big, the majority of the population is domestic rate. It's really difficult to ask for a community group to get funding and work with the entire state.
Yeah.
No resources outside the metro area.
Yeah.
It's super
Yeah.
challenging. I wish Buck were here because, I mean, our roles are basically to take this information in the Oregon State Sheriff's Association, Oregon Association of Chiefs of Police, who can advocate, and I can't promise, but I will push very hard for both organizations to advocate if there is a bill presented. Obviously, depending on what that looks like. Yeah, I just, it's gonna be tough.
Hey, Michelle, hold me accountable. I was also thinking about Casey Family Programs. A lot of times we get in-kind support from Casey Family Programs, and so we usually go to them once a year and say, this is kind of what we need for the next year. And so I don't know if we already have, I mean, they're contracting with lots of folks to do some work with us, but I don't know what our next 2026 scope of work looks like, so.
Every KC senior director has budget.
Exactly, no, I know.
Yeah.
And well, and April's there now, so she could maybe, we could nudge her and like talk to our Oregon person and, you know. Yeah, that's another avenue within child welfare that I can commit to looking into.
That's
So
what I'm
we
getting
have-
at too about the outside fund, like different
Yeah.
types of funding
Yeah.
streams that, might be a little bit more easier to access or leverage.
I wonder if there aren't like foundation grants and if there are.
I think one thing that we can do is in there are some state, like Colorado's pay for success stuff that they've done. I asked about the tax levies because I know in Ohio, has some similar geographic stuff where like there's a few main cities in Ohio and everything else is pretty rural. Yeah. They've used tax levies in the past because their child welfare system was under a consent decree for not paying kinship families. And they needed to make up a lot of money to be able to pay kinship families. They hired a firm, they created an algorithm, they figured out a tax levy, it was like under $5 per household. They miscalculated the tax levy and ended up with like $100 million. And we're like, oh. It was like the first time I've ever seen a child welfare system. It was like, we have too much money. And I was like, what is this? And so it was like, not only for kinship families, but we can do like a lot more kinship families, things like that. So, but in that of like, there are systems that have been like,
we are in trouble and we have no money, and then been able to figure out some things, which maybe in the informative report or something, we might be able to, in some addendums, offer some case studies with some other kind of like creative funding sources. That are public-private partnerships or some other things.
Well, some are also county based, right?
Yes,
Yeah, I mean, let's be honest, Oregon's about the most county-based state system I've ever seen. We say we're state, but
yeah,
we kind of operate, but I think that has been one of the harder things. It's easier to go after some of those private dollars when you know, every county is sort of their own.
yeah.
And what about the Oregon Community Foundation? Because they have all these different groups put money into the community foundation, so it might be, there's areas of the foundation that are interested in children's work. So this might be a way, or there's areas of the foundation that are interested in abuse in general, so that might be a place to look.
I would suggest for any, I mean, it's harder for us, obviously, as state and government employees to look at those things, but if there are members on this committee who are representing nonprofit organizations who are considering, like, is there a grant opportunity to continue this work? And then members of this committee might be able to say, hey, we support this, and, you know, yeah, I mean, that's another option. So for those of you from nonprofits, maybe kind of talking to your, you know, folks in your offices, colleagues, different things, and say like, hey, if there's someone else outside of any of these agencies that really wants to be involved in this system work and could apply to sort of get some funding to do that with some of the committees saying, yeah, we support that. I think that's another opportunity. Even child abuse solutions, I wonder, like.
Yeah, I think that's a good, certainly something to revisit around, and yeah, we had some conversations about bringing training for MDTs, you know, on this, so. Looking at, had some conversations with the leadership there, like looking at that, and I guess, I think this conversation about what the role of nonprofits is, right, like. Flexibility, maybe a little bit more flexibility in some ways, which is great, but I guess on the flip side, I can also say, right, like as a nonprofit that is specifically mandated to serve one county. That's really challenging, right? And so I think figuring out creative partnerships feels really important. Is there a way to, have some folks come together and, you know, apply for a particular grant, like this range a little bigger or something like that, but like that's not something we can do on our end.
We had Susan in the chat make a comment that it seems that part of the task force mandate can and should be identifying possible funding sources that are being discussed. And I think that is also a great idea. And she also just added the legislature would probably like the idea of looking for non-state funding, which is always true. They always like to know that we've explored other options before coming to them for an ask. So I think what we'll do for this kind of piece is to get a smaller group together at the end of August and in September, kind of before our planned legislative presentation, to think about kind of what could this look like based on other commission and council makeup, probably very similar to what the bill language was for 4086. And think about kind of how to explore some different budget ideas, and then start asking some legislators if they're at all interested in potentially having this as a bill for the 2026 session. I did want to ask the question again. Do you anticipate anybody will be opposed to this work moving forward with a task force or committee that we should prepare for? Do you think any of the members thought this was a giant waste of time that they may disagree with? Like, I'm just trying to think that through.
We can share with you, there've been, we've asked people to fill out a survey and go through their recommendations of what they consent to and don't consent to. So there have been objections made to some of the recommendations. We're going to be including that in the report because we want that to be heard.
So but, I mean, there was one survey submitted this morning I have not seen, but so far the like, having a task force part of it,
Yeah, just that part.
he has objected to.
Okay.
A major objection, and so.
There was one person who said that they didn't.
No, but that's like, it's most.
Okay. Okay.
Yeah, that one does not seem to be one that people have major objections to, but as a whole, there are objections to some of the recommendations, so.
Oh, sure.
But that's also something that if it's helpful, we can share that readily and not like wait till the final report is so that you can do some planning for that. You and Jesse and Rob and.
I just wanted to know if there was going to be like a significant, community member or part of the child safety system in Oregon that would not be interested or actively oppose us moving forward with a task force like this. And so, but if there is not, that is helpful, because if there is, then I think we need to all have a conversation about what that looks like.
I'm gonna speak the obvious, although it would have been nice if 4086 had unanimous bipartisan support. It had mostly unanimous, but we had a handful of no's that didn't want even a task force.
Oh, in the legislature to pass it, yeah.
Yeah, and so I think those folks will again need to kind of understand if they're opposed to us even just talking about changes. I mean, I think, for some, it was just this is another government waste, and we're just, anything with a budget attached to it, I'm gonna vote no, right? But then there were also some votes of like, I like the system the way it is, I don't think there should be any changes, and so so you shouldn't even talk about it. Like, let's not even explore this. And so I think that is something that, I count on you to figure out.
Yeah, we can manage the legislators. I just want to make sure committee members are broadly on the same page on this specific ask. Okay, I don't think I have any other questions. You guys have any other questions on next steps for this piece, for moving forward towards short session, or for the September committee hearing?
I guess I would maybe make a ask that maybe hopefully is just simple, it's just love that people thank you for volunteering to like do that next step. I know some of us, myself included, like, that's not the area I have enough expertise in, so thank you. I'm glad these people do too, but would love to be like kind of updated about the process and when and if there are times where folks who are doing work, with people day to day on this stuff, like if that's helpful. So I guess just what's kind of the communication plan, like, I think I saw a couple folks comment, right, like the connections and conversations that happen within the committee, I think were really helpful. So would just love to know that there's a plan or commitment to kind of sharing stuff moving forward.
And I think we can own some of that too, because we have, the list with
Yeah,
all
just
of
like
you,
send me
and
updates.
yeah, and we have a
Okay.
broader list.
So we ask for the same.
Great, yeah, really, people know, it's fun. I know it's work, like, and knowing that this will be long and there will be places where, okay, you all carry this part and now we need other folks to carry the next part, so just would affirm that.
It is 100% a relay. That's what I always say, is like, we're all kind of running, right? But somebody's holding the baton at different points.
Did you run track, Michelle?
No, I don't run track at all. No. But I did. I mean, I remember in school, elementary school, having to do relay races. And the handoff is trickier than it looks. That's what I remember. And I feel like that is very true with work as well. Well, thank you guys so much. And thank you for all the commitment and to time and your energy and vulnerability that you put into this work and into these recommendations. And I'm very excited for the legislature to learn more.
Thanks, everybody.
We'll be sure, Steph.
Thank you, Michelle, and thank Michelle, Ashley and Judge Susan, we're gonna close the Zoom because this next part is really hard to participate in if you're on Zoom. Mostly it's
Thank you.
acting.
Bye,
So thank you.
Thank you.
Thank you.
Bye.
Thank you.
Just as important as right?
I didn't hear it.
Okay.